So the first thing that people notice is that they will have lost their driver's licence, which can have a range of impacts. It may affect a person's ability to work, it may require them to become more dependent on family or friends, at least in those initial weeks and months following a cardiac arrest. So even if you've come out of hospital feeling good, feeling really excited and grateful for this second opportunity at life, you still potentially are going to be frustrated by some barriers that are put in your way in that initial stage. Some people talk about actually waking up feeling amazing and quite euphoric, almost a bit high, with the rest of their family around them looking quite traumatised, and go home feeling good, feeling fit and having a great recovery. Other people talk about feeling confused and overwhelmed about why. Why did they survive? What does it mean that they survived? Why do they have this second chance? Some people feel angry at having been resuscitated, wondering why they now have to deal with potential complications, new medications, difficulties that might arise. In the first few months, a lot of people talk about experiencing low mood, which can involve feelings of being a little bit flat, perhaps being more tearful, being irritable, feeling like you don't really have a sense of purpose or like your motivation is lowered. There's a few things that people can do that will protect them from depression and anxiety in those first months after cardiac arrest. We know it's really important to protect mood, to stay active, which can be really difficult if you've just had this massive cardiac event. Maybe you've been told to not exercise. You might be feeling scared about even leaving the house or going for a walk. But if you're able to maintain even a light level of daily activity, of course in consultation with your cardiologist and your GP, that can be really protective. Even 10 minutes of brief light walking a day helps to boost your endorphins, boost your mood naturally. Exercise is nature's antidepressant. Just don't push it too hard. The other thing that's really important is maintaining some social contact, particularly if you've stopped working for a period, because there's often a lot of social contact at work that we get a lot of reinforcement from. It's natural to want to socially withdraw if you're not feeling well or if your mood is low, but then you've got more time to think about things, and that's not always very helpful. So getting out wherever you can, staying in contact with your community and your support network is important.